launch the book in Melbourne. And that's why we wanted to have the launch today and to make the best and the most of our digital capacity and bring you all together. And I do think this is a really wonderful occasion for all of us and an opportunity for Martin and I think for all of us to thank each other for the contribution that all of you have made. This book has 39 chapters, 48 authors, and goes across 7 countries. So I think it's just absolutely wonderful that some of you have got up very early and others of us have stayed up very late, and that we've all managed to come together like this. When we started the book, we thought very deeply about the approach that we wanted to take with it. And I know that many of you asked me actually for a structure to write your chapters. And we thought about that initially. And then we thought about all of you and the fact that you are all experts in your field and that you all approach practice research from many different perspectives. And we actually wanted to celebrate that and to be inclusive about that. And so we looked for definitions of a handbook. And I think there's one that really sums up for me and for Martin what we were trying to achieve with this book. And I'd just like to read that out for you. Handbooks of research contain large chapters of exceptionally focused research. The incisive titles provide a comprehensive assessment on inclusive topics and present research methodologies that thoroughly describe the discipline of focus. These edited titles contain contributions from the world's leading experts and offer well-rounded coverage of some of the most cutting-edge and trending concepts. And that's what I want to really thank you all for the fact that that's what you contributed to this handbook. There's one key element that goes through all of your contributions that for Martin and I really also characterizes practice research, that irrespective of the approach, practice research is grounded in questions from practice, engages with practitioners, service users and organizations with the impact back into the practice research, practice setting. And that was just a very simple core theme that I think you will find across all the chapters that I think brings them together. Now, I'm not going to say any more because we really want to hear from all of you. And I don't know if Martin wants to add anything again at this point about his vision for the book.
I just wanted to reflect very briefly on my experience of being a co-editor with Lynette. I'm trying to think of an appropriate metaphor to describe it, and it's been a bit like conducting an orchestra, but the players in the orchestra haven't been playing the same tune, but somehow they've created a wonderful melody together, so that overall it sounds magnificent. That's my feeling of reading the book as a whole. We've got lots and lots of different voices, lots of different stories, lots of different ways of doing research. But it comes together and it somehow feels as a whole. So we're immensely proud, we're immensely privileged to have taken on this role and to have worked with you. And really, we just want to say a massive, huge, great big thank you to you all. And briefly, before we go ahead with the launch, I'd like to do something which you're not supposed to do on Zoom, which is basically, I would like you to all unmute yourselves and to give each other a round of applause and a big, big cheer. Thank you very much.
Thank you. Right, and now we're going to ask Erwin, whom I think needs no introduction, to officially launch the handbook for us. Thanks, Erwin.
Thank you, Lynette. Thank you, Martin. It's truly a personal joy and professional honor to launch this book. It's a dream I never had come true. When Martin and Lynette first asked me to launch the book, I'm old enough to remember World War II. And I remember World War II newsreels where the Queen, wearing a ridiculous hat, would smash a champagne bottle over the side of a battleship or an aircraft carrier. I must say, I drew the line. I told Martin, first of all, while the liquor stores are open, the milliners, the lady hat makers are not. And so, unlike Bruce, I'm not wearing a hat, but I'm so proud to be in this position to honor this wonderful achievement. I'm also wearing my favorite work shirt, which is a Hong Kong work shirt that I'm wearing in solidarity with my colleagues in Hong Kong. So that's the extent of my costume. Closer to home and to practice research, you may know that our governor of New York has saved many lives by using available health data to drive social policy. He doesn't call it practice research. He certainly doesn't call it clinical data mining. He calls it science. And it's science that has saved lives. So I take special pride and pleasure in watching him go through those motions in using very, very simple and direct data to drive decisions that save lives. What I want to do now, I wrote the foreword to the book, which I hadn't read for a year. So I read it the other night, and actually I think it's pretty good. One thing I love about it is that it looks forward to the next international conference on practice research, which will take place in Melbourne in 2021. So the foreword is not outdated. I do want to finally read from a section of that foreword, if I may. Special thanks to Lynette Joubert and Martin Weber for having the imagination, the hindsight, the foresight, and the international reach to bring us all together. This book celebrates them. The Practice Research Unlimited is finally here, a little late, but right on time. Congratulations to you all. Now
Thank you
I'm
very
mute.
much, Irvin. Thank you very much for those very kind words and, for your wonderful introduction to the book and for your launch today. I think, as I say, it's wonderful to have someone launch the book that absolutely needs no introduction to anyone here, which shows just how much you, as you say, you saw World War II. And I think you've also seen the rise of practice research and contributed and it's such a special way to it. So thank you very much too. Martin and I actually threw the net very wide in asking people to write for this handbook. And we wanted to include not only people with a history and a long-standing contribution to practice research, but also in thinking of the future, we wanted to include PhDs, practitioner researchers, early career researchers. And so I think reading their work, and I'm sure you will feel the same when you read their chapters, I think we can say that the future of practice research is very safe and in very good hands too. And it's been part of the book that we wanted to include that aspect and that future of practice research. And we're very pleased that the people who are speaking tonight go across that spread. So we're going to start now with people who we've termed global leaders, people who have been contributing to practice research for some time, have led initiatives in their country, and wrote wonderful chapters for our book. And Ceci, I think we'll start with you. You also need no introduction to anyone here. So Ceci, would you like to now say a few words and unmute your microphone? Thank you.
Thank you, Lynette, and thank you, Martin, for putting this book together. And in fact, I have to acknowledge Owen, because he is the teacher who lead us into this practice research arena. By attending the Mount Sinai conferences of the International Conference on Social Work in Health and Mental Health, this is a conference which is so unique. It brings practitioners and researchers together with a strong practice research focus, not evidence-based practice, but practice and research that is relevant and can be immediately usable for frontline workers, and to collect sufficient evidence so that we can also convince policymakers that such intervention is absolutely essential. Without Owen and the Mount Sinai Group's leadership, it would not have been possible internationally to pull this group together. So my salute to Owen for your hard work, and of course many of the other in the Mount Sinai Group as well. And in fact, my engagement in practice research was based on my enthusiasm to bring about change in the healthcare system, so that social workers' contribution and role and the psychosocial aspects, psychosocial spiritual aspects of the individuals can be more acknowledged and be handled, not just treating the patient as a disease or as a symptom, but treat them as a whole person. So with these years of engagement in practice research and in this community, I really feel a strong sense of being in the family where we are all pursuing a common goal of promoting practice research and sharing things which are practical, usable, and not too burdensome for frontline colleagues to be using, but can be based on solid evidence and systematic training. So I think this is something that we all aspire to and will be working hard under leadership of Lynette and Martin. And I am very pleased to share with you that we have actually published quite a number of papers on the physiological changes in the blood as a result of our intervention, which are purely psychosocial spiritual. So not drugs, but it's mainly based on our social intervention, and we draw blood and we can actually prove physiological improvement in the immune system, and the person is happier, the immune system strengthened, and the quality of life in terms of sleep, in terms of cortisol measures, all improved. So this is something that even drug cannot be doing. So I'm very proud that social workers are taking lead in this area.
Thank you very much, Ceci, and congratulations on you and your team's wonderful work, which you have put in the chapter that you wrote for the handbook. So we've got a glimpse of it there. Thank you. Now, I don't know if Mark Fisher has got a Viva with students, so I don't think he's hoping to drop in later. So let's move on to Lars. Lars Ogerhoj from, I don't know if I've said that correctly, from Denmark, the University of Aalborg. Again, a very familiar figure who I think needs no introduction. So thank you very much, Lars. If you'd like to just unmute your microphone.
Okay, thank you very much, Lynette. Well, you were close to saying my name the right way, but we can practice in the future. Well, thank you very much for having this launch and of the book, and for letting me say some few words. I think that besides hopefully inspiring and helping students, teachers, researchers, practitioners, service users, or anybody else interested in practice research. This book has already both supported, I think, the international collaboration, what I would call our research, practice research family, and local network. Looking at the local network, this has been, for us, we are 8 people writing the articles from the Danish group of authors. This has been a valuable inspiration for us. We have actually, our network is called Practice Research and Service User Perspectives, and that's also what you would find in the chapters. And we are 1 out of 6 social work research network at Aalborg University. But for our group, it has supported our goal. We have this goal of always having joint tasks. And this has supported our these tasks to strengthen the cohesiveness in the group and constantly to expand our knowledge about practice research. The ongoing discussions about the reviews of the chapters, because these our chapters has been on ongoing discussions and reviews, it has helped us to better understand what practice research actually is. We still ask ourselves the question, what is practice research? And probably we never will come up with a straight answer. But also what service user perspectives are. But also naturally, where are the dilemmas? Where are the conflicts? Where are the disagreements? Because they are there, and it has helped us, I think, better to understand this. Internationally, I think this is a wonderful statement for the group of people who have been working tirelessly over the last 10 to 12 years to develop practice research. And not only as a coherent manifesto, but a presentation of the diversity, as you already have said, Martin and Lynette, the diversity that is included in practice research. And I think this is also a promise for the future to develop practice research in different directions and with different stakeholders. Maybe this has mainly been the researchers, but I'm sure that this is also promising for the future of including much more people, much more different stakeholders. And I think it has expanded the practice research family from not only being the moms and the dads, or maybe the grandparents, but also to include children, siblings, cousins, maybe even new partners. So I would just say thank you, Mom and Dad, Lynette and Martin, for managing the family writing. Like any other parents, you have both been busy and sometimes away from home during this process. But as the nicely raised children we are, we have just kept on writing. So congratulations to all.
Thank you very much, Lars. I think you really, I love the way you describe this as a coming together of, a family of practice researchers. Being the mother and father, I don't know how Martin feels about that, but we just wanted to celebrate exactly what you said, the diversity and the inclusiveness of what comes together in the handbook. And that's really, what we've tried to be. If that's good parenting, we're very happy about it. Thank you. And now, Mira Satka, who is also from Finland, from the University of Helsinki in Finland, who also worked together with her group in Finland. Maria, would you like to now say a few words? Thank you.
Thank you, Lynette. First, I want to say that this is just a wonderful idea to have a book launch like this, because this helps to create the sense of a community at the same time. So, but yes, I'm working at Heikki Varis Institute, and we were very happy to be part of this handbook project. And we managed to contribute 4 articles. 2 of them describe the pedagogical praxis activities. How do we teach practice research for our MA students in Helsinki? Creating this praxis networking between academia and field placements was an innovative step for the Institute. It happened 2004 already. It meant that all our social workers were professionally supervised in practice skills, and also gradually we started to develop their training for practice research, which was started 2008, and the articles describe that part of our activities and analyze the results. And what we have noticed that it really makes a difference for young social workers to be trained in practice research. They become very willing to collaborate with university researchers as part of their everyday work. So the skills are there whenever there is a new idea of a practice research project. And then the 2 other articles connected to Heikki Varis Institute document. One of them documents recent PhD research by Heidi Muurinen that emphasizes the great potential pragmatism can have for practice research. And the 4th article from us is an example how ideas of practice research can be innovatively applied even in a national child protection reform, written by Laura Yliruka and colleagues. To be brief, just if I want to really summarize the meaning of this handbook project for myself, is that for me, the handbook project is most of all a document of a global movement called Practice Research in Social Work. And I have very strong feeling at the moment that this handbook will push, as Lars was also describing, our collaboration a big step further. Thank you so much. You did a marvelous job, Linette and Martin.
Thank you, Maria, for those kind words. Can I return that and say, anything that comes out of this handbook is a reflection of what you as authors have put into it, which celebrates again the diversity and inclusiveness of practice research. I'm going to name one more person and then hand over to Martin to do the rest of our global leaders list. So I'd like to ask Roz now to say a few words. Roz and her colleagues in Singapore wrote about the wonderful new initiative that they've got through philanthropic funding. And it will be great for you just to say a few words, Roz, about that. Thank you.
Well, thank you, Lynette. And of course, congratulations to you and Martin for, doing this great job of getting a whole group of people together to write on practice research, which is very close to our hearts in Singapore as well. I'm just going to, on your encouragement, say a little bit about the Mrs. Lee Chun Guan Endowed Research Fund on behalf of my 2 other co-authors for the chapter that's in your handbook. Now, the Mrs. Lee Chun Guan Endowed Research Fund, parked at the Department of Social Work in the National University of Singapore, was launched in 2018, so it's quite a new fund, although there had been many years prior to that working on the details. But its main objective is to expand social service research in Singapore. Now, this fund is actually a philanthropic gift in memory of a lady called Mrs. Lee Chun Guan, who lived through the World War I. She was the first Singapore woman to be awarded the MBE, Member of the British Empire, for tireless service for the Red Cross during World War I, and also the first Chinese woman to be presented at court to King George V and Queen Mary. So, you know, they came from a very distinguished group of entrepreneurs, and her family and grandchildren and great-grandchildren want to carry on her tradition of contributing to the social services. So they put together a fund that is specifically for social work practice research, so that we can actually work on research that can involve more stakeholders, and at the same time also improve services for our service users. I just want to maybe mention a few features in this endowment that probably may be a bit different from other research funds that we see around us. Firstly, this endowment, the terms and conditions qualify us for matching grant dollar for dollar from the Singapore government. So that really helped us a lot in being able to fund a large number of research projects. The other thing is that the fund specifically seeks collaboration between philanthropic contribution as well as contribution from academics and practitioners in social work research. Now, when we make a grant call, it's not to individual researchers or to a team of researchers, but actually it's, we make what we call an institutional call, which is to say that researchers or teams of researchers must be supported by a social service institution or agency. And the RCA is a research collaboration agreement between NUS and the research team. It's actually not signed together with the research team, but signed between NUS and the institution. So there are several, I think, advantages to this, which I would like to mention. Firstly, I think when we have collaboration with an agency team supported by the agency actually is compelled to provide time and block time off for the practitioners and their research personnel to actually work on the research project that's funded by this endowment. Secondly, because it's a collaboration between NUS and a social service agency, the research team consists of at least one academic PI, so that we can actually ensure that any research project undertaken by a research team funded by the endowment actually gets proper ethics approval from the university. And I think more important than all these administrative issues is that when we actually signed a collaborative agreement with an agency, we ensure that the findings are translated into practice by practitioners, so that we can make sure that the intent of the donors are actually carried out. So I'll give you one example. The COVID-19 has actually delayed data collection for a number of the research projects, but one of the projects have actually more or less completed their data collection, data analysis, and are now working on a deliverable for the fund. And this is a game that they are trying to develop to help social workers and families with low income to work on home ownership. Now, the funding for the game consultant to work on the game and also to help develop the facilitators manual, this was actually paid for by the agency itself. So the collaboration is really useful in that whatever findings that we have arising from the 5 funded projects we have now, we can ensure that the findings are actually translated into practice by practitioners, so that they can actually improve the services that they provide to their service users. I wouldn't take more time to say too much about the fund at this point, because a lot of the details you can find from the chapter in the handbook. And of course, the 5 projects that we are funding, we hope will be completed when the Melbourne conference comes around in 2021, and they can then, the research teams can then, share their research. So I just want to say, on behalf of our group here, thank you very much for organizing this launch, and good luck on the sales and, and telling the world about practice research.
Roz, thanks very much. We'll look forward to reading about your research in journal articles, and also to seeing you next year in Melbourne and hearing about it. It's just a wonderful initiative, and congratulations on the work that you're doing there. I'm now going to hand over to Martin to introduce the next group of speakers.
I'm going to take my parenting role just from last, just to remind people to, we've got a lot of people to speak. If you can please try to keep your contributions brief so that we can fit everyone in and we can finish within the hour. I know from colleagues joining in New Zealand, probably pretty tired at this point. So let's please bear that in mind. So now let's move back to Europe, to the University of Helsinki, Professor Ilse Jukkonen.
Unmuting myself. Yes, thank you very much. Thank you, Lynette and Martin. And from our group, we have Raija Koskinen with us. Hello, Raija. I don't see you, but you should be there. It's an honor to belong to the group of actors who have been contributing to this handbook and working for the success and development of practice research in different settings. Working with practice research certainly needs working with different organizational, legislative, educational, user-centered, environmental, economical, and political issues. It has not just to do with research, but has this wonderful concept of practice in the forefront. It's an abiding process, and this versatility is shown in the handbook, so congratulations for that. We are all active brokers within these developments on different levels, locally and more globally. That makes it an honor. One example of these abiding processes is the governmental funding of social work and the emphasis on practice research in Finland, which was yesterday enacted as a law. What makes it interesting, apart from being an enduring process and not taking the credit out of the many stakeholders involved during the different decades? But the interesting point that I want to to point out is that the contributing factor to the practice-orientedness in the national research funding was the National Applied Welfare Research Program in Sweden, which is the government's efforts for managing major social challenges through research and innovation, and that finances client and practice-oriented research in the social services sector. So we suddenly learned from Sweden, who has learned from us, other Nordic countries and UK, and things start to move. A good example of how ideas spread, and the clue is not that ideas are not strong as such, but become stronger while they circulate and collect legitimacy from persons, organizations, and institutions that transport and support the ideas. Networks and long-term processes are crucial and need support, however, not uncritical. We still need to be critical friends. And I just want to say it's wonderful to be involved in these intriguing practice research processes. And I salute you.
Thank you. Thank you very much. I'm on the water, I'm afraid. But in spirit, I am with you. Let's stay in Finland and move across to Professor Janet Anand.
Hello, everybody. First of all, I wanted to say hello to Erwin, who in 1995 taught me all about practice research in New York as part of a wonderful exchange program. So hello, Erwin, and who would have guessed that in 2020 I will be talking to you from Finland. I represent a sort of an unusual group of practice researchers here that are based here in Eastern Finland. They are from many different countries. I, of course, originate from Australia, Eni from Mongolia, Shatali from Germany, and Chilla from Hungary. And by the way, I was excited, and I'm still now excited in the future to show them around Melbourne next year, as we are all going to make our way there, hopefully. Our chapter was looking at the performance of practice research with recent refugees and their integration in regional Finland. So it was quite a unusual topic, and we were able to really reflect on our experiences in actually delivering both interventions and evaluating those interventions and researching them in the same process. And we were very lucky to be funded by the Finnish government to do so. This book is already providing an excellent text for our students in our new Centre of Effectiveness. And I did a lecture the other day where I quoted chapters and authors. And it's also a great text for our new study, or our new course on global social work. I think it really gives an excellent introduction and insight as to what is practice research. And I think that's particularly beneficial for students and doctoral students as well. And we really hope to use this text to leverage our own centre for practice research under our Centre for Effectiveness here in Eastern Finland. So again, thank you, and it's great. It was a great collaboration. Thank you, Martin and Lynette, for this wonderful opportunity.
Thank you so much, Janet. Thank you for your comments. We're going to swiftly go across the world to Graham next. Graham Simpson.
Thank you very much, and once again, congratulations, Lynette and Martin, on an amazing achievement to pull the book together while doing 100 other things at the same time. So, just a great thing. I think one of the things this gives us a chance to do is about looking forward, thinking in ways, how does this book then move, help to move things forward? And there are many different ways that can be done. I mean, we've just heard from Cece that this can have an impact at the physiological level in people's lives. I was given a fairly boring chapter, which was on methodology, rather than some of the very interesting chapters on different practice research sort of examples. But I was very, very pleased. I do believe that building and having the best designs that we can this research into the future in terms of its impact. One of the things also looking forward, I think a lot of practice research is about localised innovation and solutions, which are kind of then embedded in particular practice settings. And it would be fabulous if we can find some ways moving forward to look at ways of scaling up some of these innovations, doing larger efficacy trials on them, and being able to really deliver them at wider levels. And I think that, you know, we have such a large agenda of different things that the research could do. As the chair of the Abstract Review Committee for the Melbourne Conference, I just wanted to personally thank many of you who have assisted with reviewing abstracts. We had over 300 abstracts submitted for the Melbourne Conference, so we were extremely excited about that. And I hope that I can engage you again as there'll be a call for abstracts coming up. But one of the things in looking at the abstracts that was very interesting was that it really kind of showed us the reach of practice research at the moment and how strong it is in Northern Europe, in the UK and Ireland, in North America, in Southeast Asia and in Australasia. But there are other parts of the world which are still fairly silent in this area, particularly thinking of Africa, South America and places like that. And one of the things that I'm sure is that this book is going to be a fantastic way to be spreading the news about practice research into these other areas of the world that may not yet be so familiar with it, while inspiring and encouraging all of these areas where it's currently very strong and growing. So thank you so much.
Thank you, Graham. Your chapter is far from boring, and I think it's going to be cited by many, many students. They're going to find that incredibly valuable. And it's a really nice segue into the next speaker in terms of talking about emerging practice research in different countries. And I'd like to introduce Dr. Sadri Madhavan, who Meredith and Lynette and myself have been working with over the past few years, developing some practice research in India.
Thank you for this great opportunity to come together and be part of or be together with the great legends in the area of practice research. And I also take this opportunity to thank and congratulate the team behind organizing all these, the book itself as well as the program. In fact, in India, as all of you are aware of, practice research is gaining more and more importance. When we look into the history of our own institution, we are, in fact, even now, we are more into practice, but research component has not been adequately integrated into the practice. So now our conscious effort is being taken to integrate the research component into practice in the field. So, and in this, now our institute is also actually moving forward to integrate this research. In this context, I would like to thank Professor Martin and Professor Lynette and all other colleagues for hand-holding us. We have been engaging in practice research for quite some time, like almost 11 years now. And for last 11 years, we have developed the collaborations. It was a kind of informal way of coming together of professionals who have similar interests. But later, it has become more and more of formal one with the help of certain fundings, including the British Council funding and all. And now it is spreading into different domains. Earlier, we have been fully into or more into the chronic conditions, now disability, and then in between also done something on suicide prevention, then dementia and children of parents with mental illness, and different areas. And I think this hand-holding and mentoring aspect is very, very important for developing this practice research. That's the feeling I have, because that's from my own personal experience, that myself as well as our colleagues and also even our PhD scholars and also the PG students, they were mentored systematically through online mode and also face-to-face mode. And I think now this component has to be, I think this is a request for our entire group, that handhold more and more people so that this practice research movement become wider, broader, and I think so many people will benefit from it, and also the people will benefit from this. This is so. Once again, I thank Dr. Martin and also Lynette for this opportunity and bringing us all together in this single platform. Thank you so much.
And thank you, Saju. It's really good to see you, and thank you for your contributions. Let's move on. Next we have Dr. Laura Juruka, also from Finland.
Hello everybody, greetings from Helsinki. I'm very proud to be part of this wide network of practice researchers. I think already 12 years or so from Salisbury, a roundtable meeting. I thought I would say a few words about what has happened actually in Finland after Practice Research Conference in Hong Kong. Well, firstly, Sanna Marin has happened. Sanna Marin is the Prime Minister of Finland. She's a role model for many. And it was her government that proposed the law of governmental funding for social work research, and it's really historical. As Ilse mentioned earlier, the law was accepted yesterday in the parliament, and the emphasis is in practice research, which is historical, I'd say. Secondly, what happened, Corona, unfortunately. In Finland, you may see two people standing on the bus stop complaining, why does our government ask us to stand 1.5 meters apart from each other? 2 meters would be better. So physical distance is is okay for the Finns. However, social distance is a bit worse. So that is why Finns have made a digital jump in many areas of life, social interactions, many forms of digital and remote social work practices, innovations, and distance learning for kids and others too, such as researchers. I also want to share one special phenomenon. Lotta and her grandpa. This young lady called Lotta studied in London, and she had to quit her studies in London due to the coronavirus. She went to live with her grandpa in Finland. Every day they sing together an old Finnish song, old Karelian song. Grandpa had to leave his home in Karelia during the Second World War. So the YouTube videos are very, very popular today. They have over 26,000 followers in the Facebook, and they started only in the beginning of May. So Finns love them. So I think practice research is about enhancing social in many, many ways. For me, it has been an honor to be involved in this wonderful global movement of practice research. And I'm really happy to say warm thanks to Lynette and Martin for the wonderful work on the handbook, which will be used in many, many, many ways in education and in our work in Heikki Varis Institute. I hope we will meet in Melbourne next year. Next year will be special in many ways because Heikki Varis Institute will also turn 20 years next year.
Thank you. Thank you so much. It's really good to hear from you. And again, we do look forward to meeting next year, all being well. Now, we are going to be running over our allocated hour, but I would like us to continue because we still have to hear from some really special people who are here on the call. If you do need to leave early, then that's fine. We do apologise for overrunning, but I would like us to continue. Next, we're going to feature two Mikes, two Mikes who have been very influential in practice research. First of all, Mike Alston, then Mike Fisher, but we'll go to Mike Alston first.
Special treat to be involved with this group today and honoring both Lynette's work, which I find astounding because she not only put together an international conference, but also put together a handbook along with Martin. I find that astounding. And so grateful that you both took the leadership on this. I will be brief because there are many others who have not had a chance to speak. I just wanted to say that our work in practice research now is in its third decade. Locally here in San Francisco Bay Area in California, where we've been working with 12 county social service agencies for many years doing research that I didn't know initially was called practice research, but realized later actually that's what it was and is. Delighted to see so many of our colleagues as well on this particular call. My little talk includes an apology. When you read my chapter, you will discover that I had the audacity to identify thought leaders. And I did that basically on the number of folks who've been contributing since we met in 2008 in our first international conference in Salisbury. So if you are not included in that list, my apologies for the limited scope that I used, but I've been asked to sort of focus the chapter on the conceptual foundations of practice research and to draw on all the people who've contributed to our thinking about that, many of whom have written chapters in the handbook as well. So I just want to say how much I appreciate the chance to participate, even though it's 5 in the morning for me, or actually now it's 6. But do appreciate the immense work that Lynette put into this. I still am amazed at what she was able to accomplish and look forward to Melbourne as well. Thank you.
I was just going to say the conference hasn't happened, but we're looking forward to seeing you all next year. The program looked wonderful this year, and I'm sure by next year we'll have a lot more to add to it.
Thank you. Mike Fisher.
Can I just check you can hear me?
Yeah.
Yes.
There you go. Hey, Mike Austin, what's with the 10-gallon hat?
That's my Australian Outback.
Oh, I see. You're but you took the corks off it. It looks very great. Makes me think I should go get my hat. I'm very pleased to see you all. I hope you're all well and finding your way through the pandemic. I add my thanks to Mike's thanks that so many people have put so much work into the book, but it wouldn't have happened without Lynette and Martin, so thanks to them. I find publishing always very awkward because you never really know whether it's going to sit on the shelves, is it going to make a difference? And I haven't read everybody's pieces, obviously. But the long-term issue with this practice research movement has been to try and change the relationship between practice and research, and a more equal, a more respectful relationship. And I look forward to a future when we might have practice-driven research rather than the idea of research driving practice. So that's why I'm in this. And I hope that the book provides not only a reference point, but maybe it's kind of turning point where you've got an opportunity to direct people towards now a major collection of work on these issues. So my thanks to everybody, and I look forward to, if we return to international travel, to the opportunity of Melbourne next year. Lovely.
Thanks, Mark. And I would just like to say that if we can't be physically together next year, we've already decided we're going to go virtual with the conference. So
okay.
And create like a living document of it. So it will happen in one form or the other. I think should I go with the next two, Martin? Taken that they're both from Melbourne. They're both practitioner researchers. Kate Thompson is the manager of the Young Adult Cancer Service at the Peter MacCallum Cancer Centre, and Elise Marie Mangay works in the Accident and Emergency Department at the Royal Children's Hospital. So Kate, would you like to start with a few words?
Thanks very much, Lynette, and thanks for the opportunity to say a few words this evening. The chapter that I've contributed to in the book really showcases part of my PhD, which is focused on clinical supervision across Australia in Australian youth cancer services. My experience over the years really working as a social worker, as a supervisor and a supervisee within the Victorian health settings has really shaped my professional experience and who I am today. But in recent years, I've moved into the field of adolescent young adult cancer in a leadership role with an interdisciplinary specialist clinical team. And the nature of the work's demanding, and progressively I've observed staff leaving the field frustrated by the limited or non-existent supports within this stressful work environment. And for me, I've seen many of these professionals who have been committed to the care of young people leave, and upon leaving have taken away a vast array of practice knowledge, experience and wisdom. So for me, the curiosity really arose over time relating to the availability of, access to, and the practice of clinical supervision within Australian youth cancer services, and how it supports and can improve the delivery of quality care to young people and their families. And this chapter in part has really tried to explore this. I have to say, after seeing everyone speak before me, I feel so humbled with the quality and the calibre of leaders around the globe. But this has been a real delight to learn how to write a book chapter, first of all, but actually also to do that with my co-authors. And I have to say, particularly my medical colleagues who have really embraced practice research within our clinical service, and I think really has some great opportunities for us moving forward. And then finally, just a particular mention to Lynette, who has really supported us in writing this chapter, whilst also holding the dual role of my PhD supervisor and research mentor. So it's been a great opportunity, a great privilege to learn, to hear from other leaders around the globe. And thanks for the opportunity to say a few words tonight.
Thanks, Kate. And Elise, would you like to say a few words about your research?
Sure. So much has been said. I want to congratulate everyone, but particularly Martin and Lynette, and say that I'm sad that you're not all here in Melbourne for the conference that we've been working so hard on, but also it's actually really lovely to see your faces and to see you all well around the world. That's a really special thing tonight. My journey with practice research, I'm someone I think who's that next generation that's coming through and following in all your amazing footsteps, and to see the faces of the people whose work I read and pore over and you know, take your ideas and try to apply them to a practice setting, it's incredibly special for me. You know, I've listened to Martin talk about how we work with complex social situations, and of course our research is going to be equally as complex, and so are the interventions and solutions, and that's okay, and you don't have to make excuses for that. But for me, my journey started about 15 years ago when I was fortunate enough to see Erwin speak. He came to our hospital and talked about clinical data mining, and I was a relatively new social worker, probably still a new grad even, Erwin, in a hospital. And to hear you speak really instilled in me that as a practitioner, I need to be constantly questioning and constantly curious about my practice, and you know, always thinking about that. And that's something that I've done now through my career with Lynette's support. First doing my master's by research, and then now you know, getting towards maybe near the end of my PhD soon sometime. But it's been a long journey. So I'm incredibly thankful for the opportunity to be involved, and I know that this textbook is something that I have looked for previously, and to know that this is going to be there, and such a practical, tangible resource for not just people who are doing research students, but also for clinicians to look at this book and go, oh wow, they were doing this in Finland. I could actually apply that to my setting here in Australia, and to have those conversations and to really continue that work about practice curiosity is really great. So thank you to everyone, and hopefully we'll see you in Melbourne next year in person, but if not, definitely virtually.
Thanks, Elise. Martin, would you like to do the next section?
Let's move on to some early career researchers who contributed chapters in the book. Just because we're running short of time and Lisa needs to go, we're going to start with her. So Lisa Morris from University of Lancaster in the UK.
Hello. I'm just to say it's great to be included in this book. This is the first book chapter that I've ever done. So to be in such a book that's international has been amazing. My chapter's about qualitative research and how that relates to practice research. And it was a real joy to actually look at all the brilliant research that's going on, such as arts-based research, archival research, and then there was a really great new publication that came out with using GPS trackers alongside diaries to show how social work is on the move, but also social work can be times of stillness. So my chapter kind of brought together all those things. So thanks so much.
Thank you to you, Lisa. It's a great chapter, great contribution. Thank you very much.
Thank you.
Next, we're going to go to Christina Lainson.
Kia ora koutou. So I'm a New Zealander researcher in Melbourne, and when I was asked to speak from a early career researcher perspective, I thought I'll just say a little bit really about what practice research maybe has meant to me or made possible for me. Because 5 years ago, I was just starting out on my Master of Narrative Therapy and Community Work. So I haven't come through a social work background, but through a counselling and narrative therapy background. And one of the major assessments that we had in the Masters was we had to come up with a practice innovation and a research proposal for that. And that seemed like a terribly daunting possibility. I wasn't really sure it was possible at all, to be honest. But we had this professor, Professor Joubert, who came and spoke to us about practice-based research, and she assured us all that this was going to solve our difficulties. We were going to be able to do this practice and do this research proposition or proposal. And she obviously was very convincing, because of course 5 years later I'm not only contributing to a handbook on practice research, which is a huge privilege, I'm also I've just submitted my PhD. And I probably do fit into what Lynette was speaking about the diversity within this handbook, and I was pleased to hear somebody else mention that there isn't a tight definition of practice-based research, because I think what it's offered to me as a complete newbie researcher, if you like, is the opportunity to bring together the skills and practices that I was learning as a practitioner, and that meant a great deal to me, with research in a way that I didn't have to partition myself. I didn't have to think, well, when am I being a practitioner? When am I a researcher? But I was actually able to bring those different stances together, or they could be the same stance, and coming through a field really where there's been quite a complex and often uneasy relationship with research. It really gave space to be both a narrative practitioner and a practice researcher. So that really has created considerable opportunity for me. And in terms of where my research might go, well, it's currently with the examiners, so we'll have to sort of see whether they agree with me. But I'm very much hoping that because of the way that the research was done from very much a practitioner stance, that it will very quickly and easily be applicable to practice, whether that's through professionals or indeed to the sort of the people or people who have similar experiences to those who contributed. So yeah, so that's what it's meant to me to take part in practice research, and I feel very, very privileged to be amongst people who've been doing this for many years. So thank you.
Thank you so much. It's really good to hear from you. Thank you. Next, we're going to go to Heidi and Nana, who are from the University of Helsinki and Haikavaris, going to both speak together.
And unmuting myself now. Okay. Many thanks to Lynette and Martin for asking us to say a few words. My name is Nanne Isokortti, and I am a doctoral researcher, and I'm interested especially in implementation research, and in particular international transferring of social interventions in children's service context. And somewhere here is my colleague Heidi.
Hi, my name is Heidi Muurinen. It's great to be here together to celebrate the handbook. My research or doctoral research was about pragmatism and practice research. And I was thinking when preparing these thanks that in 1920, 100 years ago, John Dewey published a book called Reconstruction in Science, in which he criticized researchers whose dominant life occupation was investigation and who'd forgotten cooperation with the other social occupations. And Dewey wrote that it degenerates into sterile specialization, a kind of intellectual busywork carried on by socially absent-minded men. And instead, Dewey challenged the research community to be socially sensitive to the needs and problems of others and share the results for wider application in practice. And the reason practice research is so meaningful is that it follows these footsteps. And this handbook takes us further on the road in finding ways to improve the practice and do the practice-driven research Mike was speaking about.
That's right. But as we were preparing these words, we recognized that participating in writing the handbook, above all, signifies the importance of the practice research community to us, like many others have been mentioning here. And for joining the practice research network, international conferences, seminars, and other gatherings have been very important for us. And I would like to particularly thank Mike Austin, with whom I had the chance to work in Berkeley in 2014, and also Lynette, Alice, and everybody else in Melbourne who warmly welcomed me and Heidi last year there for a research visit. And back in Finland, special thanks to Mirja and Laura for inviting us to work together and providing a chance to contribute to this important piece, this handbook. And so thank you everybody, Lynette, Martin, from my behalf for this launch, and look forward to see you in Melbourne next year. Back to Heidi.
Yeah, warm thanks on my behalf as well for everybody. We agree with the previous speakers about the significance of the practice research community. And for early career researchers belonging to such a community, builds up one's identity as a practice researcher. And this kind of identity, it's especially significant when one is working in the practice field and may sometimes feel like being far away from the academia. So we really hope we see you next year in Melbourne. Stay healthy.
Thank you so much. So good to hear. And I also am very passionate about the idea of identity of practice research. And I think that gives something to us as researchers and as practitioners, which is really, really important. Finally, in this section, before I hand back to Lynette for the final wrapping up, Pernille Wisti from Aalborg University in Denmark.
Absolutely. Hello, everybody. And Lars introduced the thought about practice research family that would make me his research offspring. And then thank you for uncles and aunties, Mike and Ilse, who welcomed me last year and the year before. Again, being a doctoral student in practice research, it is important to find inspiration and learn from other practice researchers. So thank you for giving practice research so important and genuine attention. Personally, I'm very honored to be a part of a large group of authors with contributions from all over the world. I am aware of all the work that lays behind the first international handbook and what is now an up-to-the-minute overview of practice research as an inter- or transdisciplinary contemporary approach to research with a strong emphasis on social impact. And again, as other people said, it could not be done without the huge amounts of work the editors put in. Now, I have read the preview online and I find the handbook to be a lot more than just promising. It seems that so many substantial, important aspects and reflections highlight the complexity and opportunities which practice research is framed by. To me, as a doctoral student in practice research and social work, the anthology is important work, not only to strengthen the academic discussions, but also to dig deep when it comes to differentiating practice research. I have been fortunate to write 4 chapters, four chapters in different kinds of collaboration with my colleagues at Aalborg University. And writing these allowed me to rethink parts of my PhD dissertation that I'm currently writing and which is going to be turned in later this year. Researching how social workers with personal service user experiences handle their positions and how their service user experiences are important to social work practice. The foundation in practice research calls for more than just an advanced design or methodology. I'm happy to see both theoretical discussions, but also the many thoughtful sharing hands-on research struggles and the opportunities how to solve them, and I really, really welcome that. Writing together with others related to practice research and soon reading all the contributions will not only benefit my own research processes, but also take practice research to new levels for those involved. And this goes for both research and practice. And asking what the concept of practice is or could be in practice research, including thoughts about future processes and focuses in practice research, is a result of the process of writing the chapter Social Work Practice Research Developments and 4 Statements 10 years later together with Lars. So yeah, I'd just like to say I'm happy to see the results of so strong ambitions for practice research and for the emphasis on future possibilities to explore and understand and strengthen social work practice. So thank you for welcoming me to the family.
Thank you so much. It's really great to hear from you. Lynette, do you want to take us through to the end?
Yes, well, thank you to all of you. And as I said, the young and early career researchers using Lars metaphor of us as a family, I think, do promise a very interesting future for practice research. There were also 2 non-social workers who were authors of chapters. And I think the interdisciplinary nature of practice research is certainly growing. And we are definitely finding that a lot in Melbourne. And so I'd like to introduce you to them. The first one is Dr. Arno it's Dr. Meredith Newland first. And then second, we've got Dr. Arno Parolini. So Meredith is a psychologist working at the World Health Organization. She did her PhD with Martin and is currently an early, I think, career researcher, an international researcher. And so I'm going to ask her to say a few words.
Thank you so much, Lynette, and huge congratulations to both you and Martin for all your hard work in publishing this important book, and also to all of the authors that are with us today and that contributed to this book. I have to say it's really an honor to be such a part of such a global publication. I think it's demonstrating practice research in so many different countries and contexts, and as you all spoke, I really thought this isn't just about crossing the time zones, but really we're bringing together such diverse experience in social work and in these interdisciplinary fields. I imagine it's really bringing the book to life as well. So I'm looking forward to reading it. Unlike most of you, I would have to say my background is not in social work practice, but in mental health social research. I've been working with Martin and other colleagues, such as Lynette and Saju and others at the International Center for Mental Health Social Research in York. And through the work that we've done in countries in Africa and in South Asia, we've been able to demonstrate that practice-oriented research can transform the very limited mental health services that we can find in low-income countries. And it really uses a community-driven approach. So what I hope is conveyed in the chapters is that there's a lot of innovative solutions that are happening in low and middle income countries that really engage with local practitioners, stakeholders, and families to improve care for people with mental health conditions. And this is happening also in very resource-poor settings. I do look forward to seeing with the book that practice research offers a methodology that can be used around the world, but that its application is not one size fits all. And I think practice research really offers this wonderful antidote to some of the other one-sided translations of knowledge that we often have flowing in research from high-income countries to low and middle-income countries. So I'm very much looking forward to reading the full book soon and learning more from all of the experts that are here today. And thank you very much. I'm grateful for this opportunity.
Thanks, Meredith. And now Arno. Arno is a valued colleague of ours at the University of Melbourne. He comes from a large data perspective, something that looms very closely to all of us. And he's a great contributor to our projects there. Arno, would you like to say a few words? And I know that you deliberately focused the chapter on what you thought social workers would be interested in hearing about large data. So perhaps you'd like to say a few words about that.
Hi, everyone, and thanks for having me and inviting me to this event. I also want to thank Lynette and Mark to allow us to contribute to this book and the great collection of work in this area. And being new to practice research, it was quite an experience. And having worked with Lynette over the last couple of years, it's been a great learning experience of how to apply our research expertise to practice-based research. As Lynette said, I'm not a social worker, nor am I a practice-based researcher. I'm by trade an economist, and the team that I work with at the University of Melbourne has been come together from different trades in life, and we really appreciate that we could contribute to this work because we've embarked on this journey a while ago where we wanted to take our experience from working in practice in areas like public health and education and then bring together our technical skills to sort of improve what we thought could contribute to practice research at a bit of a different angle, practice improve in a different angle. And having backgrounds in physics and economics and computer science, we thought, well, we may use that to help people automate and make their life easier, which is a perspective that is often a bit not so much talked about in practice, focused research and implementation science as well, where we do a bit of work. So we've started to develop databases and automatic processes for people to support practice. And I think this chapter really allowed us then to combine two big loves that we have. One is the data technology side that says, okay, how can we support practice by making things like data collection easier and automate analytic processes? And the other one is the more theoretical side, and that's the cumulative scientific progress. And in basically saying that all different approaches to research and have they're valid and have their merit, and they should all contribute to one big picture. And coming from a systems science perspective, then, you know, anything from an RCT to database mining can contribute and has to be combined back into the system to make sense. And so we've written this with this kind of under the umbrella of this cumulative scientific progress, and hope that people find useful what we produced in there. I'm looking forward to reading all the great contributions that everybody has made. Thank you very much.
Thank you, Arno. I suggest you read Arno's chapter early in the morning with a cup of coffee, and then I'm sure it'll really resonate. And Arno is already putting his skills to, and has done for many years, in the child protection space, where he's really been able to work in systems. So thank you, Arno. And now we thought we'd ask Bruce Tyre, as the editor of a very well-known journal to all of us, to make a few last final words, hat and all. And then we are coming to the end and finally ending back in Melbourne. Thanks, Bruce.
Good morning. I hope you can hear me. I hope these are not the final words on the topic. I hope that we'll have a long continuing dialogue and publication history and execution of practice research for many, many years to come. I compliment Martin and Lynette on coordinating this group. It's like a United Nations meeting here, and it's a remarkable testimony to your coordinating skills. You were able to pull this off. I'm really delighted with this book. It's been long needed. As you know, I've been an advocate of practice research for many years. I have published research on social work practice as the editor for 30 of those years, dedicated to publishing outcome studies in our field. And I think that practice research is a specialized skill set that's often overlooked in favor of more generalist types of research training. I think that specific seminars, training opportunities, practica, and dissertations focusing on practice research can be more fully developed and should be. I actually wrote a paper about that in 1988 with a colleague, and I'll try and send it out to folks here. I personally consider practice research to be amongst the more useful research enterprises social workers can undertake, and specifically focusing on outcomes of clients. And we can divide these up into two types. The simpler type is finding out if clients got better. That's relatively easy to do. And the more complex type is trying to find out if our intervention caused them to get better. More sophisticated and difficult to do. Both are worthwhile, including the first one, simply seeing if they're improved. I can't let the moment pass without commenting on Erwin's remark disparaging my Queen's hat. You probably don't know this, but I'm a Canadian. The Queen is my sovereign, Erwin, so please speak a little more respectfully. Or was that, yeah, that was Erwin. We're friends, so he can take the grief. Anyway, I'll see you all in Melbourne. Looking forward to it, either in person or virtually. And if you have outcome studies, please consider sending them to Research on Social Work Practice. Best to you all.
Thank you, Bruce. And now finally, the very final word from the University of Melbourne. I'd like to ask Lou Harms, who's the head of our department, to say a few final words. Thank you, Lou.
Thanks, Lynette. Well, I understand the art of concluding remarks is brevity, so I will practice that art. I want to just take you in mind and spirit, if not body, to the Melbourne University campus, where we would have been welcoming you to this event in the building right next door to this one. So imagine yourself there. And really, in concluding, I say that this has just been an extraordinary celebration of the very best of practice research. It's like a living, breathing bibliography here on the screen in front of us, and the book likewise is a living, breathing entity of practice research to really celebrate. If the celebration is the first C, the second C for tonight is collaboration, and that's what practice research is all about. And I've heard that word so many times this evening, recognising the extraordinary collaboration that practice research requires between the field and academia and service users, but the extraordinary collaboration that this work really is, and the extraordinary kind of metaphors that have been raised, the orchestra, the family, whatever we use, it's a complex system, I think, that's been used, and that's the bread and butter of social work practice, to navigate complex systems. So you've done that as a group of authors and editors, but practice research does that every day in transforming the lives of people for the better. So collaboration's the second C. The third C is congratulations to all of you, whether you're the orchestra or the conductors or the parents or the children. It's an extraordinary achievement to sit and listen to the work that's been done here, and that will just transform into students learning, practitioners learning, academics learning of what this practice research space is all about. So huge congratulations, and particularly to Lynette and Martin for the achievement that this is. And my fourth C would be conference, to put in front of you next year the campus that we'll be on. Vera is on the screen here somewhere with the fifth C, which is Champagne. And we would say cheers and congratulations to all of you in person if you are in Melbourne, but certainly on screen, cheers and congratulations to everyone for the collective effort that this work has been.
Thank you very much, Lou. Yes, next year we can promise to actually do the missing part of this wonderful group, which is the alcohol. And as you know, Australia prides itself on the wonderful bubbles and other drinks, including Irwin's Shiraz, that we produce. And we can promise that to just finally celebrate this book like that. But I really want to thank you all so much for doing this today. It's night for us. It's been just a kaleidoscope to me of practice research. And it further confirms, I think, what we tried to do in this book, which is to include all of you, to celebrate your excellence, your diversity, and what you contribute from different perspectives, but which all center around practice and strengthening practice and the knowledge base around that. And I think that that's, to me, certainly my vision for the future. And I'm sure that with each time, and I think this is just a wonderful group, and it makes me realize that there's so many potentials for collaboration here, and that we can translate this into lots of different ways. And hopefully that's something that we can discuss next year when we're in Melbourne, of ways and means of doing that. And perhaps I can say, Lars, that conversation will be in Melbourne next year and continue with you in Denmark after that. So it is a growing journey, a growing kaleidoscope, a growing diversity, and I think that's a very exciting note to end on here. So thank you very much to all of you. We deliberately called this au revoir, because it's not goodbye, it's until we meet again. Martin, if you'd like to say the last words.
Yeah, just a few very final
last words.
Just to say again, thank you all so much for your time. Apologies for overrunning. It just shows that we have such a wealth of expertise, and some of that expertise we didn't get to. So we had some service user collaborators on one of our chapters. I'd like to say a huge thank you to Herminda, Ellie and Victoria for joining the call. I'm sorry that we weren't able to have time for everybody to speak, and there's other researchers here also on the call who also we didn't have time to feature, but we will meet again, as somebody once said before, whether that's virtually or in person. Thank you so much.
Thank you, everyone. Bye-bye.
Bye.